Thank you, Philip. Commissioner, ladies and gentlemen, it's a great honor and pleasure for me to be here today to present to you the content of the JPND research strategy that we have worked out together with a great number of excellent scientists and in close consultations with many stakeholders over the last almost 2 years. And you have all received this research agenda today. Our story started in April of 2010, and this is a picture of the members of the scientific advisory boards, my colleagues, who had their first meeting in April of 2010 in Stockholm, and we all remember this meeting very, very well, because it happened to be the week when the volcano Eyjafjallajökull exploded in Iceland, and so we all were stuck for 3 days in addition to our additional meeting in Stockholm. Now this was a very good basis for a scientific research strategy because we had nothing else to do but sit and discuss new ways to promote science in neurodegenerative diseases, and we hope that this helped and now shows in the research strategy. But of course it was not made up by these 15 people. We had a long and very carefully laid out process with a mapping exercise to view what is already going on in neurodegeneration research, with 3 thematic workshops, as Philip also has pointed out already, with a lot of stakeholder meetings, with stakeholders from many different areas like industry, charities, funders, policymakers, and patient and care associations, healthcare professionals. We have tried to integrate all this in a common workshop and discuss with leaders from many different fields and had a public consultation process. And this was done in an ordered and very transparent way. So I think this is a very unique document that is based on a broad consensus throughout all the stakeholders in the field. As it was already mentioned, it's online now and can be seen in many different languages on the web. To the content, we singled out 3 different areas: basic science, medical research, clinical research, and social and healthcare research. And I will point out a few of the major scientific priorities that we have identified: the origins of neurodegenerative diseases, disease mechanisms and models, disease definitions and diagnosis, treatments and prevention, and health care and social care. In terms of the origins of neurodegenerative diseases, it's remarkable that we still know very little about the ultimate causes. We have certain ideas about a small proportion of genetic neurodegenerative diseases, but the vast majority is still completely unknown in their origin. The factors that determine risk and resilience, it turns out to be, and there's a lot of new data coming out, that this is a very complex process of many, many factors determining risk and resilience. But there must be triggering events, environmental influences that eventually tip the balance either towards disease or towards remaining healthy. And the aging process is something that is still very poorly understood. We all know that neurodegenerative diseases are aging diseases of age, but we don't know what specific aspects of age are influencing the risk for the disease. We can now characterize at-risk populations much better than previously on the basis of genetic, epigenetic, and environmental information that we have. And it will be very important in the future to follow those risk populations to identify the factors that eventually determine their fate. And we also, in addition to the genetic and endogenous factors, have to put much more emphasis to identify environmental and behavioral modulators of the disease process. Now, even if we know the ultimate origins of at least certain forms of neurodegenerative diseases, that's of course not the end of the story. We have to learn how the disease actually develops. And to do that, we need to develop new diagnostic and therapeutic approaches. We have to identify, for example, the appropriate time windows, when to intervene. We know that neurodegenerative diseases develop very slowly, that they develop years, many years, before the first obvious clinical symptoms appear. and we have to identify the time window when it is most appropriate to intervene. We have to do that in models, and models have so far not brought us the right answer, because they have not reflected the entire complexity of the human system, so we have to establish novel cell-based and animal models. And we have to elucidate the biologic and environmental basis of behavioral and psychological symptoms in neurodegenerative diseases, which is of course particularly difficult because the complexity of these symptoms cannot be modeled in simple animal or cellular models. Next, on the clinical level, we need to be much more precise about definitions and diagnosis. We now realize that what we call Alzheimer's disease or Parkinson's disease probably are many diseases, and they have overlapping phenotypes, overlapping underlying mechanisms. So we need to revise and refine the current diagnostic criteria. We need to define the various subtypes that are involved, and particularly, as I already mentioned, have to try to define them even before clinical symptoms emerge, because once those symptoms are present, we are probably much too late for efficient intervention. We have to devise new and improved diagnostic tools and establish biomarkers. And as you heard, this was one of the most urgent items that has been identified by the Scientific Advisory Board, because this is urgently needed to really have pathogenetically relevant biomarkers that really reflect the disease process and that can provide links between the human and animal-based studies and provide measures for disease progression, prognosis, and treatment effects. Otherwise, we always have to wait for years and years until we can see if some symptoms change in these slowly progressive disorders. So this is something that is of major importance to all areas of neurodegeneration research. And we have to standardize and harmonize these tools and assessments to ensure comparability of results and support cross-center studies. In terms of treatment, we have a lot of efforts going on in treatments, but we have to link clinical studies and animal studies to really identify those areas that are most promising. We have to improve the selection and stratification of subjects that enter clinical trials. We have to broaden the scope from pure pharmacological trials to psychosocial interventions, and also include social and healthcare involvement in those real-life settings, which is very important to move from the small clinical cohorts of specialized patients or very selected patients to the real-life situation. And we have to pursue long-term approaches. Those are chronic diseases that have a long development. We still have a lack of long-term follow-up of those diseases and of deliveries and targeting of therapeutics to specific sites and to specific problems in the nervous system to be effective. And finally, also very importantly, we have to be aware that basic science and clinical science is one side, but the third area that we have identified, healthcare and social care, is extremely important. And so we put a lot of emphasis on this area and think that it is important to evaluate the equity of access to healthcare across the European Union, to evaluate the cost effectiveness of the measures that are being taken. We have to identify the factors that impact on disability and health-related quality of life. What we measure in a laboratory animal or what we measure in a clinical setting in a specialized outpatient clinic is not necessarily what really bothers the patients and their families at home. So we have to keep that in mind when we develop those programs. As I already mentioned, we have to relate those clinical settings to the real-world setting that is much broader than the specialized clinical situation. And we have to improve the outcome measures to better reflect the patient and carer perspectives. Finally, addressing the specific burden of neurodegenerative diseases in assisted living situations is very important. And in the end, we have to also address questions of palliative and end-of-care life, because we still, for many, many years to come, obviously, will not solve the problem of curing those diseases, so we have to really have a major emphasis on dealing with them in a way that the patients and their families can benefit from. So those are the scientific priorities, and during those discussions we also had put a lot of emphasis, in addition to those scientific priorities, on enabling activities that may help researchers to better address those challenges. And you have already seen that the program has performed a mapping exercise of the research activities that are already going on, and this will be continuously updated. So obviously it's important that we know our research capabilities. We have to develop supportive infrastructure and platforms. We have to coordinate major research efforts so that all researchers from all over Europe can benefit from these measures, from specific research centers. We have to work in partnership with industry, and this has already been mentioned this morning. There is a fear that industry will scale back their investment and their engagement in neurodegenerative disease research. We can also see that as a chance, because this may give us the opportunity to reshape the interaction between industry and academia. And I think we should take this chance and actively pursue new partnerships with industry, with maybe new models that can be developed within the JPND initiative. We of course have to work with the regulatory organizations. We also kept that in mind, and have developed or are developing ways to reach out beyond the JPND partner countries, beyond Europe, because the challenge, of course, is a worldwide challenge, and even in this coordinated fashion that is now pursued in Europe, this cannot be the end of it, and we have to reach out. And we have already developed a very good partnership with Canada, as you know, in the Centers of Excellence network, and this hopefully will be only the start. We have to strongly and consistently build capacity. One aspect that is I feel is particularly important is education and training. For example, we need more physician scientists. To really tackle this problem, we need to develop more of a culture of academia in practical medicine. We need physician scientists, we need to train them, and this is a very long-term endeavor. We need to connect, in part for that, to policymakers to set the emphasis in the future. And of course, we have to communicate this program to the society at large to really show that this is important and to get support. So in summary, I think this was a very unique exercise to bring together scientists from all over Europe to set out a common vision of 25 European countries and provide a strategic approach to really uphold world-class research that will exploit those opportunities that are given now, because the technology is moving on very rapidly and we have the greatest chance to make progress in the coming years, to confront the barriers that are still present and to provide new approaches to prevention, intervention, and care. This strategy is a holistic roadmap. It addresses the full spectrum of research and approaches that are required to achieve impact, and it takes into account the important role of all stakeholder groups in addition to the scientific community to deliver the agenda. Now I think we have presented what the scientific community thinks is the way to go forward. Implementation will be the next step, and Philippe will take the floor here to give you a few words on that. Thank you very much.